Hi, I'm Casey Isom, a plastic and reconstructive surgeon in Logan, Utah, and I want to talk with you today about a common procedure that we perform in our practice, and that is breast augmentation. Two of the most common procedures that I perform are either breast augmentation or breast reduction, because there's a large number of women who are either too large or too small with concerns to breast size, and our goal is to provide proportional feminine look. So for breast augmentation patients, they typically fall into two categories. Very young women who have very small breasts and frankly feel like a boy in tight-fitting clothing or out of clothes. And then on the other side, many women who have had children, the breasts swelled significantly during pregnancy, and then they atrophied and got even smaller than before they had kids. And so that's really frustrating for a lot of women. So those are two of the typical candidates for breast augmentation. So a lot of women will have a question. In fact, one question that was posed to us is, should I wait until after I have kids to have a breast augmentation? And that's really a personal choice. I can tell you that it is safe to breastfeed after a breast augmentation. And women, I guess, who have already had kids and say they want to have one more, I would say go ahead and have your child. Once you're past that, then we'll go ahead with the breast augmentation. And the reason I say that is if you tend to swell significantly when you are pregnant and breastfeeding, and then you have breast augmentation before that, there is a chance, there is a risk of maybe getting stretch marks on the breast. Because if we augment a breast and make it much fuller, and then the breast swells during pregnancy, there is a risk of having stretch marks on the skin. So in a scenario like that, I would recommend let's just wait, get past the pregnancy and breastfeeding, and then go ahead with the breast augmentation. Otherwise, for a young woman who naturally did not have much tissue, a breast tissue at all, a breast augmentation would certainly be appropriate early on in the 20s. With regards to breast augmentation, there are a lot of choices. First of all, the choice whether or not to have the operation. That's a very personal choice, and if you have questions about it, we'd be happy to sit down and talk about that. But breast augmentation is typically done in the operating room. You're asleep for the procedure. Most of the time we're using a very small incision right at the inframammary fold, right at the crease. Studies show that that provides the best access to the pocket where we want to put the implant. It provides the lowest risk of complications, the lowest risk of infection, the lowest risk of capsular contracture, and I'll talk about what that is, and the lowest risk of malposition. So for those reasons, most of the time I'm going to choose, along with you, an incision at the inframammary fold. Now there's a question, do I put this implant above the muscle or below the muscle? There are a lot of factors that go into that. Most of the time we're putting the implant under the muscle, freeing up the muscle enough so that when you do workouts and flex and activities, it's going to minimize movement of your implant. Talking about implants, you do have some choices, and now there are thousands of implants available on the market, starting from saline implants, which were only available for straightforward cosmetic augmentation up until about 2006. Saline implants are basically a silicone bag filled with saline. Now this one has some air in it that leaks in over time. A saline implant would not have that big air bubble in it when it goes in your body. Basically, it's a deflated bag that is placed in the pocket and then filled up with saline. The main advantage to saline is it's less expensive than a silicone gel implant. The main disadvantage is it feels less soft and natural, and there's a higher risk of visible ripples or wrinkles. But saline is certainly an option, and it can go through a smaller incision. More popular and more common now are the silicone gel implants. And we now have highly cohesive gel implants, which are a firmer gel, but they still feel very soft and natural, and they have a much lower risk of rippling or wrinkling once they're in the body. These highly cohesive gel implants also come in a shaped implant, where the implant holds its shape. So in certain situations, we would use a shaped implant, oftentimes used in breast reconstruction after breast cancer, but other times used in certain patients. If we're going to go on top of the muscle, the shaped implant works very well. If an implant is placed under the muscle, the vast majority of the time, a smooth, round, soft silicone implant will work very nicely. And again, they come in all different shapes and sizes. Some are more projecting. If you look at this, this is a moderate projecting implant. And then some are highly projecting for more of a round look, a fuller look, if you will. And then there's different softness. Other implants have a very soft gel. So a woman who has a little bit more natural breast tissue, these implants would work very nicely because there's lots of natural breast tissue to camouflage the implant. Feels very soft and natural underneath. So those are kind of breast implants in a nutshell. Again, they come in many sizes and shapes, and what we do in the consultation is try to find an implant that's going to fill out that envelope of breast tissue ideally. If you think about a very expensive handbag, if you walk into a Coach store and these really fancy, really expensive handbags sitting on the shelf, they're all stuffed. They're not overstuffed, they're not understuffed, they're filled out to exactly the right proportion to give a nice natural shape and a nice good looking handbag. And breasts are way better than a handbag in that they're way more important. But a breast, if it's properly filled up, it's going to give it a nice natural shape. The last thing we'd want to do is overstuff that breast or go beyond the natural borders of the breast. Once that's done and too big of an implant is attempted to be placed in that small space, that's when significant problems occur after breast augmentation. So my goal and most of my patients' goal is to have a very nice, natural, proportional looking breast that in clothing and workout clothes looks very nice and natural, doesn't look done, and that usually provides a very long-lasting, stable, and aesthetically pleasing result. So when we talk about any surgery, though, we certainly need to talk about risks, and this is a major operation. It's not something that you want to take lightly. I would recommend, if you're planning on a breast augmentation or considering it, that you sit down and visit with a board-certified plastic surgeon. That's someone certified by the American Board of Plastic Surgery. And in our practice, and in practices around the country, there are certain implant companies that will not sell implants to non-board certified plastic surgeons. They won't sell to cosmetic surgeons or other people who don't have the same training. The reason is because when you look at large numbers of patients who have undergone these procedures, they see that the best results and the most reliable results with the lowest risk of complications is when this procedure is done in the hands of a board-certified plastic surgeon. So do your homework, find out who your surgeon is, what their training is, before you go ahead with any sort of procedure. We do our operations in the operating room. It's the most sterile environment, and we do certain things to minimize the risk of complications. Because when we talk about this surgery, there are potential risks of bleeding, infection, chance of an implant leaking or rupturing, chance of a firm capsule forming around the implant. That's called a capsular contracture. When a implant goes in your body recognizes that it's not your tissue. So it's going to form a soft, smooth capsule around that implant. In cases where there's infection or bleeding or not perfectly sterile environment, or gloves with powder on them, or some patients just have a propensity to form a thick, heavy capsule, that capsule could become thick, firm, and hard and cause what's called a capsular contracture. Now, there is a surgery that can be done to fix that, but in my opinion, it's best to avoid it from the get-go. So we do lots of things to try to minimize any risk of a capsular contracture. Again, there are potential risks, but the patients who have this procedure are very happy, very satisfied. Once it's done, they just feel more feminine and more proportional. So if this is something you're interested in, we'd be more than happy to sit down and talk, spend a lot of time answer your questions, and find out if you are a good candidate for breast augmentation surgery. Certainly if there are any questions, any other questions that came, perfect. So again, thanks for your time. I appreciate you spending time to educate yourself. And again, please feel free to call on us for any questions you may have about breast augmentation surgery. Thank you.